So I know that we went through a lot of information yesterday, and that you guys had all practice patients set up, but I also know that you saw patients yesterday. So maybe you had time or maybe you didn't to do your practice patients, but hopefully in time you will have the ability to do that, because I promise you as clinicians, we learn so much better when we get our hands on it. So yesterday we went over logging into the system, what the chart looks like, how to get to the record, the patient record, which we call the patient encounter, and how to do your admission visit. Okay. So today what I want to talk about is what we didn't finish yesterday was completing that admission visit. We had one more step that we wanted to do. So if you remember right, we were dealing with Sally Test on March 2nd, and we did her admission visit. And if you remember right, when you clicked on her name on your calendar, you had a green plus, and that's how you added your documentation. That's how you added your notes so that you could start documenting. Then you saved and closed because you were done in the patient's home, but you weren't done documenting. So now we want to finish our documentation. So when we click on the patient's name again, this time we get that edit pencil instead of the green plus that lets you back into that note. So it lets you back into your documentation. When it opens back up exactly the same way as it did before, and you open to the header and supplies, and you open up to your 4 tabs. Now I went through between our meeting yesterday and our meeting today, and I went ahead and filled out all the documentation in here so that you guys could see how things flowed. So yesterday we looked through the clinical documentation. We looked at adding an apply on demand wound. We looked at the different sections and talked about some of them that are required from a regulation standpoint. We went to our medications tab, and if you remember right, we entered all of our medications, including our medication kit. And we reviewed all the alerts and the drug-to-drug interactions and the side effects. And then we approved our medication profile after that. Next, we went over to the orders tab, where we added our frequency orders. And we added, as the nurse, you're going to add your frequency orders. So if you're seeing the patient twice a week, you'll be adding that and your PRN orders. And then you'll also be adding the orders for the aid if the patient is going to have aid services. So we got that all done yesterday, and we were down to the last piece. And the last piece is adding your aid care plan and adding your problems, interventions, and goals. Now, it's important to get your aid care plan done as soon as possible because your aid cannot document until their care plan is completed. So let's say that your aid is going to go out the same day that you're doing the admission. They're going to go out later, but they're going to go out the same day. Then even though your service note or your visit note isn't completed, even though you may not have medications entered, whatever's not done, you'll want to go in and add your aid frequency so that they can have a visit on the calendar, and you'll want to add your aid plan of care so that they can actually document that visit. So to add that aid plan of care, again, we're going to be on the Orders and Care Needs tab, and we're going to go under this first section where it says Orders. Under where it says Care Plan, under the type says Care Plan, and we're going to go to the far right and hover over that drop-down arrow. And I am moving slow today. Sorry about that. What I want you to focus on right now is we will be talking about all these in time, but right now I just want you to focus on Add Care Need. So you have the green plus, and the second one says Add Care Need. Now, a care need in Careficient is a patient problem. And when we think about creating the aid plan of care, the reason that we need an aid plan of care is because the patient problem is that they need help with their hygiene. So this box will open up, and you're going to give it a start date, which will be the date that your aid is starting to see the patient. If you don't know that date, you can put in the start of care date. It doesn't matter. You're going to put in the discipline, And as nurses, we tend to always want to put our discipline, but remember, you're creating this for the aide. So we're going to scroll down until we see HHA. And what will happen is all of our care needs will open up. So these are all the different patient problems. For the aide, instead of being addressed like a problem, it just says hospice aid plan of care. And it's the first one at the top. You're just going to click it. You do not need to have a level. And then you're going to click Save. Once you do that, it's going to move that aid care plan down to the next section, which is called Care Needs. So here's Care Needs. And tell me if I need to blow my screen up some more if you can't see. And right under Care Needs, you have Care Plan, you have a from date, which was the date the patient was admitted, and you have Aid Care Plan, Hospice Aid Plan of Care. So for this, you're going to scroll clear to the right again to the drop-down arrow. When you hover over the drop-down, this box opens. You're going to click on the Add Goals. And for your aid, the only goal we have in here right now is your hospice patient and or caregiver-centered goal. If there's additional goals that you want in there, we can put additional goals in. You will not be doing a goal status right now. That's going to come later. And you don't need a start date or an end date right now. We'll talk about when those come into play later. So we're just going to click Save. The next thing on our list over here in the list of links is Edit Goals. Now we're going to skip Edit Goals because Edit Goals is if you're changing your goal after you've already started a goal. Excuse me. The next link is Add Interventions, and that's what we want to do. So we're going to click on Add Interventions. It's going to bring up the list of interventions that you have. Your first one, I put a number 1 in front of it so it would float to the top because that's going to be your patient summary, or that's what we're calling your patient summary. That's where in your old system you would put your notes that you want your aide to know. You know, maybe that they need to use a gait belt when they transfer, or that the patient is a DNR or is on a pre diet, or whatever you guys used to put. That's what your summary is going to be. Then you're just going to select which of these are appropriate for this patient. Okay, so I'm just going to go through here and select some. I'm going to say they don't have a catheter. This other box, I'm going to go ahead and select it, and I'll show you what it does. We'll say that they do have oxygen. They are a DNR. Did I transfer the patient? Let me see. Is this the transfer? Okay. So I selected the ones I want. Again, you do not need a start date. You're just going to click Save. We're going to then go to the next one on the list, which says Edit Interventions. Again, you're going to skip this one because this is used for when you're ending an intervention and starting a new one, which you're going to see with this particular patient. So I started this patient with a shower, but at some point we're going to change it and make this patient a bed bath, and this is how we're going to do it. So we're going to skip this for now, and then we're going to use the last two. The last two are Edit Goal Description and Edit Intervention Description. And what you can do with those is when you click on one of them, for instance, the goal, Edit Goal Description, it will bring up your goal. If you click on the goal, it puts it in an editable box. So here you can put in your your hospice patient and or caregiver centered goal. So you're making it individualized for that patient because you know surveyors like that. Then you're going to go to your Edit Intervention Description. And first you're going to click on your patient summary, and this is where you're going to put your patient summary in, or your patient information, the information you want for the aide to have. Then for each of these, you can change them any way you want. So assist with dressing every visit, assist with ambulation every visit. Let's say you want to change something specific. So this says offer oral supplement every visit, but you know that this patient gets Ensure. You can edit any of these, which is why we have the other listed here. And I'm actually going to add some additional others. That way, if there's something that you want to order as a task for your aide, you'll have a place to put it. You'll be able to just click on the other, get rid of it, and put in what you want. When you're completely done with everything, as far as editing, you're just going to click Save. And your aid care plan is created. Does anybody have any questions about creating that aid plan of care? Okay, so then we're going to move on to adding your problems, interventions, and goals. And it's the same functionality that we did when we added the aid plan of care. So we're going to go over again. We're under the Orders and Care Needs tab. We're going to go to the top section where it says Orders. We're going to find the care plan and go clear to the right. Hover over that drop-down and add care needs. Again, you don't have to worry about the other things on this list. We will go over them in time. We click on Add Care Need. That same box opens up. You're going to put your date in, either your started care date or the date after. This time when you select the discipline, you're creating these for the nurse. So you're going to select RN. Even though you're selecting RN, it's also going to flow to your LVN's notes. And then you're just going to scroll through here and see what works, what's appropriate for your patient. So the way these care needs are set up, we've got the hospice aid, then we have the hospice bereavement plan of care, and then a pre-bereavement, then it goes through chaplains, a hospice discharge plan, and then all the RN ones come up. So we're just going to go through these RN ones and see what works for this patient. Let's say they're living in an alternate facility. I know they have agitation, constipation. Here's all your different changing level of cares. Don't forget that has to be care planned. Risk for aspiration, incontinence. And you can choose as many as you want. Remember that you can't fix everything at once. And so if there's something that is at risk for, you may want to, some of those things you are going to use, but some of them you don't want to have like 50 care needs because that's too much to work on at one time. Remember, your care plan is supposed to be a live document. So we're going to be adding new problems to it. We're going to be potentially taking some problems away, such as knowledge deficit. But a lot of times in the hospice world, a lot of those problems don't go away. Okay, so when we added that, it puts your care needs down here on the bottom under the care needs section. So here's your care needs section. And then if you look at this column, 1, 2, 3, 4, the fourth column, it shows you here's the RN ones that I added. And we're just going to go to the far right, hover over the drop-down, add goals. Your goals that are in here are related to your problems based on standards. So you're going to select your goal. You do not need a goal status. You do not need a start date or an end date. That all is going to come later. You're going to skip your edit goals, go right to your add interventions. You're going to skip your edit interventions. Then you can go to your edit goal description if you want to edit it, or your edit intervention description if you want to edit any of these. Then you're done with that one, and we're going to go on to the next one. And I'm going to go through these rather quickly because once you start doing them, it will be very easy for you. So I'm just going to run through them so I can get these added so we can go to the next step. And these, it seems lengthy, but you'll get used to knowing what is in here for goals and interventions, and you'll be able to just boom, 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 select whatever you want. In addition, if there's goals and interventions or even problems that you're used to using or you're used to seeing that aren't in here, you just let your leadership know. They know how to add new problems, interventions, and goals, or they can let us know and we can assist with that. And one more, and then we'll move on. Oops. So once you've created these are going to each flow to your IDT. Why is it just like that? And to your new restart period. So you're only going to be creating them one time unless as time goes on and you do routine visits, something comes up and you're adding a new one in that sense, which I'm going to show you that when we do our routine visit. Oh, no, why is it doing that? I don't know if that's my screen or that's... Okay, we'll let that go. Okay, so now we're completely done with our start of care note. We've added our medications. We've added our frequencies and our problems, interventions, and goals, and we've added the 8 care plan. So we're going to go back to our service note tab. We've already got our time in and time out. We've got our signature not required because that's what your policy is right now. So instead of saving and closing so that you can get back in it, you're going to complete it. So in your current system, you guys call that you're going to lock it. So just think of this as the same way. You're going to lock that note, because this complete button locks it so you can't get back in it. Now, that doesn't mean that if something happened you couldn't get back in it. If you needed to, your leadership could open it back up, but when you hit complete, it locks it. Also, when you hit complete, it is going to put on, oh shoot, okay, hold on. Let me put in the same time. There. Okay, I told it to go ahead. What it did was it was checking, and it noted that you did a visit or that I did a visit on a different patient at exactly the same time, because I used a different patient for group 1 and used the exact same time. So it was asking me if that was okay. I said yes. So when you complete it or you lock it, it puts your electronic signature on it. You're just going to accept your electronic signature, which then is going to close your note and lock it, and it's going to take you back to your home page. And it goes quicker than this. Mine's just slow today. So now when you look at your home page, remember this is your calendar, and you look at Sally Test, and you hover over the piece of paper that's to the left of Sally's name, you now see where it says a completed service note exists. That means you've locked it. So if you would click on it again to try to edit it, this is what you're going to get. You no longer get that edit pencil because you've completed it or, quote, locked it. Okay? Questions so far? Okay. So today what we're going to do is we're going to look at a routine visit and see how that looks different and how your interventions and goals flow through for your documentation. And you guys typically do a visit the next day, so you do a follow-up visit. So I think I've got a follow-up visit on this calendar. Okay, so let's say the next day comes. I'm going to go out and see Sally Test again. I log into the system, which is my home page, which is my calendar. I see Sally Test on my calendar. If I hover over it, it tells me that it's a hospice RN routine visit. And I've just got to Sally's home, and I'm going to click on that visit. Again, just like before, when you click on the visit, this box opens, and you're looking for that green plus that says Add Page Service Note Assessment, essentially meaning you're adding or opening your documentation for your visit. Again, it's going to take you to the page to ask, are you doing this electronically, meaning a regular visit, or are you uploading a papered visit? And we're doing it electronically. It's reminding you that you're doing a hospice RN revisit, and you want the hospice RN routine visit or revisit note. So when you come down here to select your note type, you're going to have the hospice RN routine visit. Your note's going to open up the same exact way. It'll have all 4 tabs, and it'll open up to the header and supplies. So this looks familiar. Just so I can show you this, because I did not show you before because we were doing it on a admission, but once your admission documentation is complete, all of your other notes, as well as the other disciplines notes, will have a section when you scroll down called clinical data. So what this is for is it pulls the information from your note, from your start of care. So it gives gives the other disciplines that haven't seen the patient a snapshot picture of the patient. Now, right now, these say no functional limitations, no activities. That's because we had not approved that note yet. But now that it's approved, it will flow. So just so you know it's there, I educate the aides to scroll down there, look at that, so they kind of know what they're walking into, even though they've had a report from you. Again, this is all set up the same way. Here's your change sections if you want to jump around. If you notice in your sections how we talked yesterday, how if you add a wound, an apply on demand wound, once it's added, it will automatically be there for your next following visits until that wound is healed and ended. So if we go down to under integumentary assessment, we see wound pressure ulcer 1, and that's not normally there. That's because we added it, or I added it when I did the start of care documentation. You'll also notice that under this view, other orders or assessments, there's my hospice admission. So if the nurse that's doing the day 2 isn't the same nurse that did the admission, which happens because a lot of times you admit people with the on-call staff, then they can just click on that visit. If they want to look at something, it's going to open up that start of care in a PDF document so that they can search and look for whatever it is that they want to look for. So let's say I wanted to look at something specific. Control F. Let's look at, I wanted to look at weight, which I didn't add, but that information would be in there for you. And you'll be able to look at any notes, so any discipline, whatever notes have been documented on or visits have been documented on will be there. We go up here to the top, we still have the same tabs. Here's all that medications tab. Here's your orders and care needs tab. So let's go ahead and go through this note. Now, as I go through here, I still have a few requested changes from your leadership that I have not got to yet. So there's going to be a few little things that may be different when you go through. Let me start that over, though. But when we go to the very first page, if you remember on our admission, right after our header and supplies, the next page we went to was your diagnosis codes. For your routine visits, the very next page you go to is your interventions. So here's your problems in this column. Then you have your interventions in your second column. In your third column, you're going to put in your task action response, or what your response is. Now, there'll be RN notified will no longer be on there. I'll be removing that. I just haven't made the time to do that yet. Well, that will be on your aides' choices, but not on yours. So you're going to say, whether this task or this intervention was completed, not applicable to this visit, or did patient caregiver refuse. Now, because depending on how many problems the patient has, some of those problems you're going to address every time. So for instance, if your patient has anxiety and one of your interventions is to assess anxiety every visit, then every visit assess anxiety is going to have a completed, you're going to say completed. But for some of the things, such as skilled nurse will assess for depression, suicidal thoughts as needed at patient visits, maybe that wasn't needed this time, so it's a not applicable. Skilled nurse will assess for signs and symptoms of constipation. That's something you're going to look at every visit. So you're just going to answer these as appropriate. If you want to put any comments in this box, you can. You do not have to, because your assessment is going to follow. So when we go next, it's going to take you to your goals. So you've got your patient problem, you've got your goal, and for your goal status, it's either met, in process, not met. Now, with hospice, a lot of times they're going to be in process the majority of time. Patient will remain free from constipation impaction. That's going to always probably be in process because it can get better, but then it can get worse again. Some of the things as far as education, you may be able to meet if it's an education goal. Then you're just going to go next, which is going to take you into your visit note. For your routine visits, even though I know as nurses you guys really aren't doing a whole lot of telehealth or maybe not any telehealth, in hospice as nurses for your routine visits, there are times that you may have to, like for instance if a facility doesn't let you in. So this is the very first piece, and this is just saying whether this visit was in person or whether it was a telehealth visit. Remember, CMS considers a telehealth visit to be a visit that was done two-way audio-visual. Going to take you into your next note or your next section. And let's see on this one. There's nothing there. Okay, so for this, your hospice diagnosis, your diagnosis-related to terminality, and these four components here are going to flow. Now, they will not flow to this first routine visit. So for the first visit after admission, you're going to have to put them in. But then every routine visit after that, it will flow. When they hit this copy data forward, it will flow forward. They'll be able to see what was documented last. Does that still pertain? If not, they can change it. And I'll show you that on another visit. Okay, so we're going to go next. Your vitals, which is the same pretty much as your assessment or your admission. Your pain assessment's a little bit different because it's not as lengthy. It doesn't have all of those HIS questions in it. Ask you if they've had any recent infections, meaning any infections since you were there last. Takes you into your neuro. All of these sections are a little shorter because they're not as comprehensive because it's your routine visit. Now, here is your is patient on oxygen. So if your patient is on oxygen, yes, and an oxygen assessment hasn't already been done, then you can go do your oxygen assessment as an apply on demand section. And this would be in the case of a patient that maybe wasn't started on oxygen on admission, because of course that's going to be done on admission, but maybe you started oxygen on this visit. Then you're going to do that. Going into your endocrine. Your GI. Nutrition. GU, and again, you can notice they're a lot shorter than the admission. Musculoskeletal. integumentary. So when we get to the integumentary assessment, because the patient had a wound last time, the wound's going to be next. You can also look at where the wound is on the body. Even though the wound documentation shows a location, if you want to look at the body, you can click right here where it says Add Edit Wound Assessment, and it's going to give you your body. So it's going to show you where that wound is at. You can also add an additional wound. So let's say you have another wound that shows up.
Do that? So what? I can't add a visit. I can only do a note. I can't even.
Christy?
Somebody, yes?
Yeah, we had a question in here.
Yes, ma'am.
So someone asked a question that brought up a question that I have. So we have different visits of a comprehensive visit and then that we call a V5, then a V1, which is a shorter. Sorry.
Oh, I could answer that question afterwards.
Okay.
Yeah.
Also, and on our test screens, is it true that if we click on any test, we can't start a visit? We can only write a note. I wanted to follow along, but when I click on, I've tried several different tests, and I don't have that plus sign in my box.
Is your test patient assigned to you? Was that patient on your calendar?
Oh no.
That's why.
Okay.
Okay.
Actually, you know what? Even there is one on my calendar that I couldn't open my own personal one. I couldn't do that.
Well, I think today we just want you to follow along with Christy so that, yeah. Okay.
I do better when I follow along by clicking with her, but that's fine.
And also another thing that sometimes tripped me up in the beginning, you can always open a visit and document after the fact. You cannot open a visit prior to. So if you're trying to open a visit that's scheduled on the calendar for tomorrow, you won't be able to until tomorrow. I don't know if that's what you're experiencing or not, but just as an FYI. Okay, so then we're just going to click Next. When we go next, this is going to bring up our wound. So this is the wound pressure ulcer number 1 that was added on admission. It automatically put the Apply on Demand section here. Now we're just going to copy previous data forward. So we're going to click on that. And it's going to bring up, that's not really how it's supposed to work. JP, I must have turned on the wrong rule. So essentially, you won't get a choice. This box will not come up, so I apologize for that. What will happen is when you click that copy previous data forward, the information will automatically pull here. You won't have to tell what document or choose which note that you're pulling it from. It'll automatically come here. So this is the wound documentation from admission. So was it confirmed with a physician? Yes. Location, sizes. Trust me, I'm not a wound nurse, so this probably doesn't even make sense, but that's okay. I'm in stage 2. Any drainage? If drainage, what's the type? The tissue surrounding. Is there any odor? And then wound cleanse with, topicals used, dressings applied. So all you guys have to do then is change anything that needs to be changed. So if this is the day after, then there's probably no changes, or you may not even be looking at the wound. But let's say it's a week later, and you look at the wound. That information is going to flow from the very last visit, the very last time that the wound was assessed. And if there's something that needs to be changed, let's say this time the drainage is small, you want to remember to go ahead and edit your documentation. Okay. And then just go on to your next section. Does that make sense? And JP, while you're on here, jump in there and see what rule I have turned on. Because what we want it to do is we want it to automatically copy. Instead of with this copy previous data, they get to choose which note they want it copied from, whereas the rule I want on is it automatically copies the last note. Okay. And we'll go on. Okay, so then we're going to our Edmonton assessment. This is another one that I thought about, and later that we can talk about this at a later time. This is another one that may be something you want to think about pulling the data forward as well, And here's my thought on that from a QA standpoint, is that sometimes if it's not the same nurse that is doing the visits, they don't know how the patient was rated the day before. They do know the patient was worse, but how you look at say, nausea between a 5 and a 6 sometimes is based on personal assessment. And so the Edmonton doesn't work as well if you don't know what it was documented before. So that's just a thought. That's a maybe. They would still need to change it if pertinent, if it needed to be changed. But okay, then we're moving on to our routine medication evaluation.
Christy.
Yep. Yes, sir.
Which aid, you're in the training one, right? You're in the Livingston Hospice training, right?
No, I am not.
Are you in the live one?
Let me tell you where I'm at.
Okay.
I'm in because the training environments, I'm always afraid that they don't have everything set up the way that a regular.
That's okay.
I'm in VHO.
VHO.
Yeah.
Okay. Good enough. Thanks. I'm checking.
Okay, so again, we go to the hospice routine medication evaluation. We're going on through our note. And I'm going to stop right here before we finish the note, and we're going to talk about another thing. So let's say that during this routine visit that you note that the patient has symptoms of a UTI. And you call Dr. Dial, and Dr. Dial says, yeah, let's go ahead and start the patient on Bactrim. You can go ahead and go right to your medications tab, and you can add your new medication. So you're just going to click like we did yesterday on Add Medication. Your entry type is going to be New. You'll just start typing your Bactrim in here and click Enter because we're connected to the drug database, which is going to give you the different dosages, routes, and forms. You're going to put in your patient dosage. It's got your route. What is your start date? And again, you don't have to fill out anything but the start, but if you want this on your med profile, then you do want to fill it out. I need to find Dr. Dial in here. Let's just do a D. There he is. Administered by, pharmacy, physician notified if there's a second physician on the case. And this time, because you took the verbal order, you do want to put your name in here. Now, there won't be any other name come up, so it'll only be yours, but you don't want to leave it blank this time because it's going to repeat and verify and sign the order. Is this hospice covered? And because this is after the start of care, we're going to create an interim order. So we're going to create an order that we can send to Dr. Dial for him to sign. This I just have to change because I'm doing this in the past. And you'll save and close. It's automatically going to run all that same drug-to-drug information that it did before. So let's give it a chance to do that. Let's find it on here. There it is. It's automatically going to give you your alerts, your drug classes, your, over here, your side effects, pharmacological information, patient education in English, patient education in Spanish. Let's see if we have any drug-to-drug interactions with it. We do. We've got one at a moderate level. Your policy probably says major, but regardless, we have to show that we ran the drug-to-drug interactions and the drug review and that we noted it. So again, we're going to click on this approved medication profile. It's certifying. You're going to say that you certify that you've reviewed and documented all the current patient meds per agency policy and have notified the physician of any potential adverse effects, significant drug interactions, and duplicate ineffective drug therapy and potential contraindications. Now, because there was no major drug interactions, you don't have to notify the doctor, but you're going to sign that you did note that.
Okay. Christy?
Yes, sir.
Sorry to interrupt, but actually, because I got to go, I got another meeting here real quick. Okay, so the service note section's ability to copy auto-apply
That's it.
is not turned on.
That's the one we want.
That's the one you want.
Yep. Thank you.
Okay, because I've got to run. I got another meeting here,
fine.
so I just wanted to make sure. So,
That's fine.
okay.
If you'll turn that on, that'd
you.
be great. Thanks, JB. Bye.
It's on now.
Thank you.
Bye.
Okay, so we've added that spectrum. If we want to go over and look at the orders tab, you'll see that's where the written order was created. So if we go to the orders tab, here's a medication order that was created on 3/3. If I open up that medication order, here it is. Here's your new medication, your Bactrim, repeated and verified by clinical trainer, already signed and dated. So it's ready for the approval process from the office, and then it'll be sent to Dr. Dial depending on how he's going to sign orders. That's how it can be emailed, it can be faxed. He can log in, and if it's approved, he can sign. Excuse me for my voice again. I'm just going to save and close that so it creates the order for you. The other thing that Dr. Dial asked you to do while you had him on the phone is change a medication that you already have ordered. So he decided that, let me see what this med is, that we wanted to increase the Loratab because the patient's having pain. So if you're changing a medication that's already on your med profile, so last time we added a new one, we want to just change a dosage or a frequency, you just have to go to the medication that you're dealing with and click on it. When you do, it brings it up in this box and it's grayed out. So it shows you that it was an existing order of Loratab 32510, 1 tab every 6 hours as needed for pain orally. We want to change that dosing. So we're going to click on this change dosing medication. It's going to open up your dosage and your frequency and your route. Those are the things that you can change. It'll keep your drug locked down because we're not changing the drug. And it changes your entry type to change. And we're going to say that this patient can have 1 tab every 4 hours. You're going to put in the, excuse me, it's going to automatically put in the date of your change. It put in today, but I'm documenting in the past, so I changed it. You're just going to change what's appropriate. So this one was prescribed by Dr. Dial. Oh, shoot. And I passed him. And if you start just typing his name, DIA, it'll bring him up. You repeated and verified. Yes, it's covered. Yes, you want to create an order. Save medication dosing. What that does is it puts your new dose on your med profile. Give my computer a second. It's so slow when it goes through WebEx. If when you work with the system, if it's so slow, you need to let me know because that would make me crazy, and we'll have to fix that. So now it shows the new dosing here. Oops. I'm trying to move there we go. So every 4 hours. And if you go over here to your status and look at inactive meds, it'll show you DC'd the old one. So instead of having to DC a med, then write a new med, you can do it all together.
We're unmuted
Okay, so
first.
Christy?
I'm sorry.
Hi, Christy. I have a question for you. It's Julie in the other room.
Yes, ma'am.
Do you have to go through every single individualized med with the little triangle alert? How do you cancel that alert? Or does it stay there forever?
It stays there forever because what you can do is you can click on it. You don't really cancel it, but when you click on it, it'll open up a printable document that's got the alerts on it for you to share with your patient.
Okay, thank you.
You're welcome.
I've got another
Okay,
question. I've got another question. So if we're switching from lorazepam tabs to lorazepam solution, do we have to delete the whole thing and start again, or can we edit within the order?
If you're changing the route, let's see. So you're saying you want to go from tablet to solution?
Yeah. Is that a whole new order, or can we modify it? Because it looks like you maybe don't have that option because it's grayed out.
That's right. That's right. So in that case, you can change the route, but if your description shows tablet, and it's going to depend on what the drug database gives you. Some of them will say tablet, some of them may not have the word tablet on there. It just depends on what the drug database gives you. But otherwise, yeah, you'd have to DC the tablet and reorder the liquid.
Okay. Yeah, because yesterday when I was doing the admission and they have like the comfort pack kits and whatnot, the scrolling option didn't work. And so if I wanted to edit just one thing in that whole package, then I'd have to, I guess, like if you can't scroll it and then remove it, then you have to go through this process where you add it and then you delete it and then you add another one.
So when you say the scrolling option didn't work, do you mean when you added the med kit?
Yeah. So like my tablet's really small. Yeah, my tablet's really small. And so I couldn't scroll in that part, right? Where you're scrolling, like it I don't know.
So I wonder what kind of tablet do you have?
It's a Samsung.
You might, I know you guys have an IT person, yay, because I'm not an IT person, but and I know nothing about IT, even though I work for an IT company, so I apologize. But there may be something they can help you with to get that scroll ability to work better.
Yeah.
Because you want to be able to, when you add your med kit, you want to be able to scroll through these and get rid of or change ones that need to be changed, so that you don't have to do it, go through each one once it gets into your med profile.
Okay, thank you.
So, you're welcome. Okay, so we have found a patient problem when we were at this visit. We got orders from doc that we took care of, but don't forget any patient problem, any changes, we've got to update the care plan because, you know, surveyors like that. So we're going to go over to your orders and care needs section. We're going to find that care plan, and we're going to go add another care need to cover our infection. So if we hover over that drop down, we're going to click on add care need. And just as a reminder, because this is what's going to update your care plan, you're going to go find your infection. And I think I've got an infection one in here, infection. So you'll add that with today's date, which is going to show the surveyor that you're updating your care plan. You're going to scroll down, and here it is down here, and you're going to add your goals and interventions. And don't forget, if you want to edit any of those goals or interventions, you can do that. Okay. Going back to our service note, we're done with our visit. Sorry, we should have put our time in when we got here, and I didn't, but we're now going to put our time out. Down here under patient signature, we're going to mark not required. If you're completely done documenting, you're going to hit the complete button, which is the lock. If you're not done documenting and you want to get back in, you're going to save and close. I want to go ahead and hit the complete button because we have time, and I would like to take you to one more visit. Oh, shoot. Okay, so what this is doing, this is not letting me complete my note because of these errors. So what it's saying is you didn't answer these required questions. So part of the requirements that are in here right now are that you address your interventions and goals. that you address each one of them, even if it's not applicable to this visit. You got to put something in here or it won't let you close your note. That's what completes the live care planning. So you're addressing each of these, and I'm not reading them, I'm just grabbing. And that's why it didn't let me close. If there's any other required sections in your note, something that your leadership has determined is required, and you don't answer it, it won't let you complete it until you answer it, but it'll tell you what it is. Not only will it tell you what it is, that those red links that it gave you, you can click on the link and it'll take you to it. Okay, so we completed that. So what I want to do now is I'd like to go show you another routine visit because I'd like to show you how that copy forward works. So let me see if I've got one in here. I do. Hold on, let me assign it to myself. Now that JP turned the right rule on for me. Okay. So here we are. Here's, whoops, Sally test. We're going to add our note, regular, routine visit. And I'm going to just jump to the pressure ulcer. Okay, so now here's your pressure ulcer that's already in there. Hit this copy previous data. Oh, it still didn't do it. Shoot. Okay, so we didn't get it turned on correctly. I'll show you that next time because you shouldn't have to choose which note you're copying from. It's going to automatically copy it from the last one. So I apologize that he didn't get it turned on. Okay, so questions so far. We've been through the admission, we've been through the chart, we've been through the admission, which included scheduling, it included adding your aid care plan, and it included adding your care needs, interventions, and goals. We looked at a routine visit so we could see how to document towards those interventions and goals, how to change a medication, how to add a new medication, how to add care needs. Oh, I got one. Okay, so let's say that during this visit that you note that the patient has had a significant decline and you are concerned about a fall risk and you no longer want them to be a shower, you want them to be a bed bath. You can go to your orders and care needs tab. And if you recognize this during a visit, you can do it during the visit. Let's say your aide calls you and you're not in a visit and says, oh man, I just think he needs to be a bed bath now. And there's a discussion and you determine, yes, you can do this outside the visit as well when you go to the patient chart under the orders tab. So we're going to change the aid care plan. So here's our aid care plan, and we want to change from a shower to a bath. We're going to go over to the drop down, and we're going to use those two links we didn't use initially. Oh, this screen. Which is going to be, I got to see why I'm jumping to it. I don't know. Are you guys having that trouble at all when you're in here? Let me see if I got the aid care plan. I do. Okay. So what you're going to do is, once you hover over that drop down, we want to end the shower. So because we're going to stop something that we already had ordered, we're going to edit the intervention. If you click on Edit Intervention, it brings up the interventions that you assign to the aid. So we're going to go down and we're going to find shower, and we're going to give it an end date. And click Save. Then you want to go add your bath. So you'll go to the Add Interventions, find your complete bed bath, and give it a start date. So that now what the aid's going to get flowing to her note is the bed bath instead of the shower. Did that make sense?
Christy,
Yes, ma'am.
we have a question in the room. So we've done all the documentation, but we didn't see the clinical note. We went
When
through
you
the
say you,
revisit, the narrative,
oh, in the revisit?
correct.
Okay.
What did we not add?
So here's your narrative.
So you have to
If we
pull it
want
in.
to look at the notes are going to somewhat end the same way. So they'll all end with a narrative, with a place to document if you had to do any collaboration on the plan of care. So in this case, yes, we had to collaborate on the plan of care because we changed the aid care plan. So we did discuss that with the patient and the family. We discussed it with the aide. If the patient's in facility, with the facility nurse, whoever we discussed it with. Then your next one is going to be your IDT comments. And remember, for your IDT comments, that's what's going to flow to your IDT. So patient with symptoms of UTI, whoops. Actrum, pain increased. So that's what we want to discuss in IDT. Then for your RN visits, you also have your aid supervisory section. And then if your patient is getting an LVN, you'll have your LVN section. Now, one thing that I'm adding on here that I haven't got to yet is you'll have a question up here at the top that says, does patient have aid services? Yes or no? Because if they don't, obviously you're not going to fill that out. Here it'll say, does patient receive LVN services? Yes or no? And then if they do, you'll fill out your supervisory piece. Did that answer your question about the narrative?
Yes, Christy, thank you.
You're welcome. Sorry, I jumped around that note, didn't I? Because we were on our med evaluation. And then we went to, after that, if they're not having a social worker or a chaplain, we still have to do a comprehensive assessment. So we're just asking if there's been any changes psychosocially or spiritually. Then there's your narrative and then on. Okay, other questions?
Christy, this is Jean. I was wondering
Yes,
if you can go back a little bit and show them how to put their orders in and assign a visit to themselves.
Yes. Okay, so putting in your frequency orders?
Yes.
Okay.
Where you're at.
So there's two different if you're in a visit, just remember that with the medications and with the orders care needs, you can do it in a visit, which is handy if you're already in the visit, but you don't have to do it in the visit. You can always do it outside the visit as well. So let me go show you that and we'll do it from there. Let me go to my patient encounter, which is my patient chart. So here's your patient chart. Here's your meds tab. And if you'll notice, it looks just like your meds tab inside, my system. Okay, inside your visit note. And then here's your orders tab, which is the same as your orders and care needs tab inside your visit note. So there's your orders, there's your care needs. So you can do these in either place. Excuse me. So for this particular patient, we've already got to put orders in, to put frequency in. You're going to go to your care plan and you're going to go to your edit pencil instead of the drop down. When you click on the edit pencil, it's going to open up your care plan. And we're going to talk about this other stuff here in a minute. But let's just go down to the calendars. Now, we're not going to be able to do I'm not going to be able to show you the frequency here because the frequency's already been done. So I'm going to take you to another place to show you. But this is where you're doing your frequency in your care plan. Hold on 1 minute. But I'm going to open up a different order type so that I can show you scheduling. I don't want to confuse you, but it's the only other order type that gives you the calendar. So I can show you scheduling in the same way as inside the care plan. It just gives you this. So let's say we're going to do the skilled nurse frequency. And let's say we are starting the frequency on the 9th, because that's when I opened this order. You're going to just scroll down, and under your disciplines, if you click on that drop down, you've got all the different disciplines under here. If you're doing yours or skilled nurse, we're going to choose skilled nurse. Your frequency options are week, month, day, every, and PRN. And what's important about these is that that's what the system's going to hold you to. So if you schedule something per week, the system is not going to let you move it outside of the week. If you schedule something per month, it's not going to let you move it outside the month. So for a nurse, you're typically seeing your patient on a weekly basis. It gives you under amount the different days. The days really don't matter because you can move the visit on your calendar. What really matters here is the amount that you put in here. So I'm going to say we're going to see this patient twice a week on Tuesdays and Fridays. And I'm going to say we're going to do that for the duration of this benefit period. When you click on duration, it's going to give you the amount of weeks left in the benefit period. It won't let you schedule past the benefit period. So this is telling me there's 13 weeks left. I'm going to click 13. Now, it's possible that these days aren't going to fit in the last week, but we're going to see. We'll click Add. And in fact, it does tell me that the days selected don't fit in the last week. So I'm going to change my duration to 12 because I know that they'll fit in the 12th week, and click Add. And then when I scroll down, it tells me how many days are left in the 13th week or the last week. Well, the benefit period ends on Sunday, so we don't need any this week. So there's your skilled nurse to week 12. Now we want to put in your PRNs. So you're going to go back and do your discipline is still your skilled nurse. Your frequency, you're going to change to PRN. And you're going to put in how many PRN visits that you want for this time period. Just remember, you do not want to order more PRNs than you have scheduled frequency. And then you're going to click Add. You'll notice when you add the PRNs that they don't show anywhere here. And that's because we don't know where they're going to be scheduled. And I'm going to show you how to get to the PRNs. Now, while you're here, you'll notice here over here under the order description, the skilled nurse is highlighted. When it's highlighted, this edit order description box is open. So if I unhighlight it, you only have one box. So you need it highlighted so that we have the second box, because we want to put in our orders. And these are our orders that are what I would call standing orders that don't necessarily need to be in a care need intervention and goal form. So to get those, you're going to go over here to this little blue, what looks like a Lego to me. You're going to click on the blue Lego, and it's going to bring up all your standing orders. On your second column where it says type, you can filter to skilled nurse. And you're just going to go through here and pick what's pertinent for this patient. And click Save. When you do, it's going to place those down here under the Edit Order Description, where it's going to allow you to edit them if needed. You can edit any of these. So let's say PRN if no BM after 3 to 4 days. Edit whatever you need here. If you want to spell check it, you can use this spell checker right here. And of course, some of them aren't going to be in here. And then when you're ready, you're done with it, you're just going to update. it's going to move it to the top. Now, let's say you want something that's not in your standing orders. You want something on there. You can add it as well. So you're just going to do an enter and add whatever else you want on there and update. Then you're going to go do your aid frequency. So your discipline is going to change to HHA. Typically, they're still weekly. You're going to put in their days. Again, even if you choose the wrong days, the days can be moved on the calendar. We now have the aid highlighted, and remember, they don't get PRNs, so we don't need to do that. We're going to click on our Lego, filter to HHA, add that order, and update. Now, here's an important piece that a lot of agencies miss in the beginning. Like I had one yesterday call, and she said, I ordered my visits, and they're not on the calendar. If that happens, what you want to do is you want to go look at your care plan and go clear the bottom and make sure that this is gone. Because once you click this schedule discipline, that's what's putting the visits on the calendar. If you would open this back up after you've hit schedule discipline, that schedule discipline link will be gone. So if you still see it on there, let me go to my order. If you go in there and you still see that link, see, it's gone. It's because you forgot to click it and your visits won't be on your calendar. That's what puts them on the calendar. Now, if you want to assign a visit to yourself, you guys do have schedulers. You have a scheduling team that routinely is going to be attaching your visits to the right associate. But let's say you need to attach one to yourself because you got to go see this patient right now. To do that, you need to go to the patient's calendar. So your home page is your calendar. The patient calendar is when you go into the patient encounter or the patient chart and you click on scheduling. That takes you to the patient's calendar, which is right here. And you're just going to, depending on whether you're doing just one visit or whether you're scheduling all the visits, here's how you do it. If you're doing just one, you're going to click on the visit that you want to schedule to yourself. This box opens up and you want to click Edit. Edit is going to allow you to either change the visit type or assign who's going to see the patient. So I'm just going to override because right now your HR files aren't ready, and I'm going to assign this visit to myself. Now, let's say you wanted to go ahead while you're here. I'm going to help the scheduling team, and I'm going to go ahead and schedule all these visits to myself because I know I'm going to be taking care of the patient. You can schedule in a group as well. So to do that, you're going to come over here to this left-hand side, and you see where we still have skilled nurse under choose discipline. Skilled nurse is still there. You're going to go down until you find yourself on this list of nurses, and there I am as clinical trainer. And you're going to go to the right to the calendar with the green plus. When you click on that calendar with the green plus, it's going to bring up all your visits that have been scheduled for this patient. There's all of them. If you want to schedule them all to yourself, again, you're going to have to click this override availability check because your HR files aren't ready, and it's automatically going to click all of these visits. So in one click, you can schedule all those visits to yourself. It does happen very rapidly. You're not going to see that right now because, number one, my internet is really slow today, and I am going through WebEx. So anytime you're taking a software through a software, things slow down. But this would have already been scheduled. It had already been done. So it is a nice, quick way to schedule a 3-month time period. You can also unschedule in that fashion. So if you schedule it and you go, oh, darn it, I scheduled the wrong patient, or no, I'm really not going to be here, you're going to go find your name again under skilled nurse. You're going to go find your name and go to the right. instead of the calendar with the green plus, you're going to use the calendar with the orange-red negative. When you click on that, it's telling you it's going to unschedule all these visits. Now, it unchecked the first 3 or grayed the first 3 out because those visits have already been documented on. We're just going to click save, and it'll unschedule all those visits. Did that answer your question?
So this is Jean. How do we
Yes, ma'am.
schedule visits on the weekend for nurses that have to go out and see patients that aren't theirs?
Okay. So is it, in that case, would it be a PRN visit or would it be a scheduled weekend visit?
No, it'd probably be PRN because they're calling
Okay.
saying they need a visit.
Yep. So if it's a PRN visit, you'll find that in the patient encounter, there's different places that you can find PRN. Now, I'm not going to show you all those places. I'm going to show you one place because I think it's the easiest. And the reason I pick this place is because you have to go to the patient's calendar anyway. So you'll see scheduled PRN in various places. But if you go to the patient calendar, because you have to assign it to an associate anyway, you'll see a link that says schedule PRN. So if Sally Tess called and needed a visit on the weekend, you would just go to her calendar. You would click schedule PRN. It tells you how many PRN visits you have available. You're going to put in the date. So let's say in this case, we're going to see the patient on the 20th, which is a Saturday. You can put the reason if you guys tend to do that. If you don't do reasons, you don't have to. That's up to you. It doesn't make you do it. And then you're just going to save and close. What that's going to do is it's going to put that visit on the calendar. There's the 20th. It'll put a little piece of paper to the right, which tells you it's a PRN visit. And if you put in what for, it'll tell you what for. You're then going to, of course, click on that visit and click edit so you can assign it to the right associate. So let's say I'm your call nurse this weekend. You'll assign it to me. Now, if we go click on that PRN, schedule PRN again, you'll see it keeps track. So now you're down to 5 and you used 1. It will not let you schedule a PRN if you don't have an order for it.
What happens if that happens? What happens then if we can't send the nurse out then? How do we get around that if say they're actively dying and they're on daily visits and
And you don't
they had
have
to
any
go
PRN
back.
visits?
Yeah, and they had to go back later on that night because patient was really agitated or whatever.
You have to write an order because any visit you've got to have an order for. Now, a lot of the systems out there today will let you plot an order and do the visit. I'm sorry, plot an order, plot a visit and do the visit without having an order. And one of the biggest deficiencies is that your orders and your frequencies don't match. So you're actually practicing without orders. So in our system, we don't allow you to do that. What you would have to do in that case, if you were out of PRN, so let's say for this patient, let's just use this analogy. This patient has plenty of skilled nurse PRNs because we ordered plenty, because I actually wrote it twice. But let's say in this scenario that this family is in crisis and you've got to send the social worker out and there's no PRN visits for the social worker. You're going to go add an addendum order. The addendum order is the other order type that gives you the calendar. That was the one that I showed you earlier. So you're going to, if you don't have PRNs, you're going to go add some PRNs. So here's your calendar, and you can just do PRN. So let's say for the social worker, we need some PRN visits. I'm going to give them 3 because it looks like we have several weeks. In your edit order description, the only thing that would go in here would be your PRN reason. So let me find your PRN reason. There it is. And then you'll scroll down, schedule discipline. Go to your patient calendar. You now have PRNs for social workers. Whoops, where's it at? Hold on. Oh, yes. For your addendum orders. Now, for your care plan, those visits will go to the calendar even if your care plan is not signed or approved. But for your addendum orders, come on, let me back in here. For your addendum orders, you'll need to sign it as the nurse. And approve it for those to be available. So what a lot of agencies do, and what I did when I ran an agency that had a system similar to this, was that I didn't wait to see, I didn't want to get a call in the middle of the night that a staff needed to go out and they didn't have a PRN. That's the last thing I wanted. I didn't want to have to go through this whole process. So I had a process in place where I had a staff person that always was watching and checking to see if all patients had PRN orders. Like at IDT, that was their role. When we were in IDT discussing patients, they would look at every patient that we discussed and made sure they still had PRN visits available. Does that answer your question, Jean? I think that was Jean that asked.
Yes.
Yes.
Okay.
Can we see adding, Ro, just quickly, the goal, one goal and a care plan to the nursing one?
I'm sorry, say that one more time. I missed.
Oh,
You cut
I'm
out
sorry,
part of it.
it's Jane. If you can add care needs. One more time. One more time.
Sure, sure. Adding it for your patient?
Yes.
Okay.
Adding the care needs.
Okay. And just remember, I'm going to do it here in the patient encounter under the orders, but you can also do it within your visit under the orders and care needs. So to do that, you're going to find your care plan and you're going to go to the drop down. And you're going to click on add care need.
She's just adding the care plan.
You're going to put the date in that you're adding your care need or your new problem, the discipline that the problem is for. And if you're walking through with me, tell me and I'll slow down so you can be caught up with me, because I'm a hands-on too. That's how I learn. Then let's say the patient's actively dying. Maybe that's the care need that you're adding. You're going to save that, and it's going to put that care need down under the care needs section. And there it is. Once it's down there, you're going to go clear to the right and hover over the drop down. You're going to add goals. For whichever goals are appropriate for your patient. You do not need to do a goal status. You don't need to do a start date. The only time you use a start and an end date is if you're changing, if you're ending a goal and starting a new one, or ending an intervention and starting a new one. Then you'll go to add interventions. And then if you want to be able to edit either one of those, you're going to either click on edit goal description or edit intervention description. And when you click on it, it brings it into a editable mode. Now, I don't know if you guys were going along and doing that. If you were, I probably went way too fast. I can slow down and we can go through it together. Or do you have other questions?
This is Jean. We're okay in this room.
Okay. Room 2, are you guys all right?
Yes, Christy, we're good. Thank you.
Perfect. Okay, other questions? Okay, so essentially, you guys have been through what you're going to be using the system for a day-to-day function. Now, I'll tell you, there is a lot more that the system does. However, it's things that you're not necessarily going to have to use from day to day. So we're not going to overdo you and give you all that information. We just want you to focus on this piece now and taking care of your patients with this day-to-day stuff. Then as time goes on, we'll give you more. And so within, say, 6 months from now, you're going to have more information on how you can do other things in the system. But for now, if you can focus on those two, practice on your practice patients. If you're practicing on one of your practice patients and you get to something and it's like, this isn't working, I don't know what I'm doing wrong, the system's not working, call me and I will walk you through it with your practice patient. Because what I don't want is for you to get so frustrated that you forget what you've learned. And software can be frustrating for those of us that aren't software people. And many of us, myself included, do not have a software brain. It's just not how my brain works. So I get where you're at. I really do. So call me and I will walk you through what your problem is.
Christy?
Yes, ma'am.
It's Jean again. I have a person in here that does the on-call. Can you show her the on-call form? The nursing visit on-call form real quick.
Yeah, and I'm trying to remember. Okay, so there's we have two things. So if it's a triage phone call, let me go to my patient.
Actually, she'll be doing the actual visit in the home.
Okay, she'll be doing the visit in the home. Okay, so in that case, you're most likely going to be using a PRN visit. So let me go to this PRN visit. Okay, so that's my PRN. So you're going to access that PRN off of your home page. And probably, let me reschedule it because I imagine when we scheduled it, we didn't take the time to change it. Where's our on-call PRN? Okay, so it should be scheduled. Whoever's scheduling it, or if it's you, if you schedule it as a PRN visit, then it'll be set up as a PRN visit. So you'll log in. You're on your home page. You're working. It's the 20th of March, and you see that you've got a PRN visit for Sally test. Just like the others, you're going to click on the visit. You're going to add the page service note assessment. It's going to be a regular, but you're going to be choosing the PRN note. So the hospice on-call unscheduled RN assessment. And let's see what that looks like. Okay, first of all, let me go in and give you the rest of I want you to have all of the tabs at the top as well. So let me give them to you real quick. And I promise all this stuff is going to be ready by the day you go live. I am still working on changes in your system, so that's why this isn't ready. But I'm going to fix it right now on call. Okay. And I want you to have the meds tab also. All right. There we go. Okay, so yours is going to start out the same way. You'll have all the tabs. There's your meds tab. There's your care needs, orders and care needs. Here's your visit. It's going to start out the same way. You're still going to have the interventions and goals, which obviously the majority of yours are going to be not applicable to this visit because you're going to be just doing a focused visit, or what I would call a focused visit. So in our focus visit, we have vital signs, because you should probably do that on all focus visits. We have pain. Edmonton, I don't know if I want that in there, and cardiorespiratory. After that, it's going to take you to a section called focused problem. So after your vitals, pain, cardiorespiratory, you'll come to a focused problem section. Here is where you're going to click on this apply on demand so that you can choose which system is your problem. So if the patient had a fall, you're going to probably do a musculoskeletal assessment, and you're going to probably do a MAC-10. If the patient's in pain, you already have your pain ad assessment, but you may need to do different pain assessments. If your patient has a potential UTI, you're going to do the GU. So whatever is going on with your patient, you're just going to select your focus and save. It's going to put those two sections in your note. When it does, and it happens more rapidly than that, when it does, it takes you back to the beginning. You're just going to do your change section and go to the systems that you added. And you'll document on those systems that you added. Now, because this patient already had a wound, it's automatically going to give you the wound.
So Christy,
Yep.
since it's flowing the wound onto that PRN visit, are we going to have a button up there that maybe says not assessed at this visit if she's at night, just maybe changing a catheter or something? Does she?
We can.
Yes, because can we do that for the on-call one? Because, you know, she's really out there just doing a focused, and I don't want to leave it blank.
Yep.
Okay.
I think any
applicable.
possible PRNs, you're going out for
So we
end of life, you know, you might not be checking.
Yeah. So
yeah, I mean the only systems that are going to routinely come in here is going to be your vitals, pain, and cardiorespiratory, because most likely, unless you guys tell me otherwise, that's what I would assess no matter what my focus problem was. If you don't want all of those, if you want all of these systems considered focus, and all you want is vitals there, that's up to you.
That's fine. So on this PRN, do we have the actively dying? Can we add that on apply on demand?
If it's, yep, if it's not there, we can. Let me see if it's there. But that would be a great one to have on there. PRN.
So Jean, would this be the visit, the focus problem visits, would these be the visits that the weekend nurses would do?
No, we'll discuss that afterwards, but this is, I have Jackie in here. I think April's in the other room, so I just wanted to show them the actual on-call, you know, like what they would do at night.
Okay.
Yeah, what you would consider a true focused visit.
Yeah.
You're only there for the problem. It's still going to give you your, still going to give you your narrative. It's still going to give you your coordination, because that is a huge deficiency. So if you're there at night, it's possible that you're having to change the plan of care, and that has to be collaborated with the family and with the physicians. So that's still there. And your IDT comments are still there because you want to be able to have that reported or in IDT.
So Christy, so we have our LBN who works at night too. So she would still pull down this RN one, or do you have a separate on-call LBN?
She'd do the LBN on call.
Okay, but the form is essentially the same, but missing like the IDT and stuff. Okay.
Christy?
Well, no, the IDT comments will still be there on the LVNs. The only thing yeah, this one would be exactly the same because there's no supervisory piece. So it would be exactly the same. It would just be labeled differently.
Okay.
Yes, ma'am. Did someone else have a question?
Christy, sorry, yes, we do. So on these PRN visits, there's no narrative assessment tab, like we had before?
There is. If there's not, then I need to put it in, but I think there is. Let me look.
See it.
Sometimes things just pass me by. Previous. There we go. Narrative of changes in patient assessments, status, interventions.
Thank you.
You're welcome. Sometimes I just click too fast.
Yeah, I need a narrative. Thank you.
Yeah, the narrative will be.
I have to make my comments.
And then
anything else?
Jackie, just put in the IDT box, just put, LPN and then copy and paste that in and then just go to the IDT now.
Oh, that's so nice.
Yeah, that's nice. And there's a talk feature that will kind of teach you guys.
Wow.
All right. Any other questions in here? We're okay in our room.
Okay, anyone else?
Christy, you had mentioned that if we had an issue to call you, how do we call you?
Yes, ma'am. Let me give you my direct line. So you can always call the support line, but then it'll take a little bit to get to me. I'll give you my direct line, and this comes right to my desk. It's 772-600-4197.
Thank you.
Now, if I'm on the phone or I'm in a meeting, it'll go to my voicemail. So you can either leave me a message and I'll call you back, or you can shoot me an email, whichever is easier for you.
Did you hear that question, Christy?
No, what was the question?
Do you stay up late at night?
I do answer sometimes at night, and some nights I am up late.
Ooh.
But she's on a different time zone.
I am on a different time zone, so
What's
which
your
may
time
be even
zone?
better. I'm in the central time zone, so we're 2 hours different.
Oh, that's
Ahead?
to our advantage. Yeah, they're ahead.
Oh, cool.
No, it's later there.
It's later there.
Never mind, it's not our advantage.
Although I always say I'm moving to California because I like your time zone better. I don't like mornings as well.
Right.
Same here.
I know I've kept you too long. I apologize. Is there other questions? Now we do have a meeting. We have a meeting set up again just for kind of questions answer. What are you having problems with? And I believe that is set up next. Let me see. When is that?
Is that for all of us, Jean, or just leadership?
Just leadership.
That's up to your leadership people. But essentially with you guys, if you need to meet again, let them know and we can meet again. If you need to do that before we go live. So I'm happy to do that again once you get in there and you start playing around and you're like, if we need to meet again, let me know. Okay. Anything else?
I think we're okay. I just have a few questions after, I guess we're okay, you guys, right? No questions? Okay. Christy, I just have a few questions. I went through the assessment form and there were a lot of other boxes, but there were nothing to, like another box to document other. Like frequency of oxygen, for instance, it said other, but really maybe there should be a box like not in use or in the home not in use or NA.
Tell me, are you looking at the admission or are you looking at the routine? Okay, so let me pull the screen over here. where I'm in is me. Oh, shoot. That's not what I meant to do. Let's just look at it real quick. We can either look at it if you have time, or you can mark what you want added and send it to me. That's up to you.
I have time. I just had a question because I think a lot of sections had that and I just didn't know, like.
All right, let's go.
If we
Well,
just
usually I put it, usually I put another box under there, like a comment box, but let's look because there may be ones that don't. So let me. Okay, whoops, maybe that's too big. So let me go to my notes, and you're talking about the admission.
Yes.
Okay, let me find it. Here we go. And what was the first one you said? It was under the respiratory section?
Yeah, pull up oxygen, for instance. The respiratory.
All right. Okay. So let me look at this in a print view. Okay, it must not have, was it in the respiratory section? Did I miss it? Okay.
Patient screen, yeah. Where was it? We had it in another section, maybe. Hold on. Can you go back up a little bit? Maybe it's in another section. I mean, I just wrote them down as I was scrolling through. How about, I think the lungs, we're still missing the right middle lobe.
Oh, yep, that's one of the things. I've got a whole half a notebook on you guys that I still need to fix from your guys' requests or changes that you want me, that because it's been back-to-back meetings, I have not got that done.
Oh, okay.
But I got them.
Okay. Maybe go under cardio.
Okay.
There was another section that said other, but there wasn't a box. I found a lot of them that say other, but no box.
Yeah, if you see them, even if we, don't find them all right now, if you see them, shoot me an email so I know to go look at it and add the comment box. Because usually I'll add a comment box under it, but let's look at this one. Okay, so wait, I'm sorry. Sometimes I scroll too fast. I apologize. Okay, so chest pain, we got all the symptoms, comments. So like all of your pulses, you had other as a choice, so I put the other box under here. That's what it should normally look like. So if you see one that's not, then we need to add that.
So maybe the one I did it yesterday, so I'm not sure. And then like under the ESAS at the end, there's, other, and normally there is a box.
Let's look at that one.
Fill in what.
Yes, there is. And that, I had not seen other problem before, but it was on the revised one. Are you guys used to seeing this, the other?
Well, it had it on the one I did last night. It had other, but no box for me to write in what symptom, the other symptom, to fill in like secretions or whatever.
So let me put it here. So, but when you used this Edmonton before, did it have the other on it or not?
Yes, it does. And then it has the box where we would fill it in.
Okay, there we go. So I added that.
Okay, well, you had the other, but it just didn't have a box to fill in.
Right, now it has a box.
Okay.
So let me show it to you.
Okay, yeah, because I just saw other problem and then I
Yeah.
could rate it, but it had nowhere for me to put what the other problem was.
You know what let me see. There's one thing I could do that I wasn't thinking. Some days, the older I get, some days my mind just doesn't work as well. Why is that? I'm telling you.
I don't know, I have that same problem.
I used to be able to, like, boom, on a dime. I'd know what I was doing and what I was talking about. Anymore, I want to pull it up, and I'm just going to search for the word other. Let me find the hospice, RN, admit. So we'll just search the document. Boy, my internet has been slow this week. Oh, come on.
And I could have been doing this, I was doing this late yesterday evening, so like under edema, I thought it was missing either none or NA, not, you know, the patient didn't have any, we just checked that box.
But she's gonna see.
Okay, so I'm going to look for other, and this is in the admission note.
Mhm.
And then we're still in the section.
Okay, so there's one. That's all right. That's okay. That's all right.
Yeah, these ones are fine again.
Up front.
Oh,
Other. Oh, here we go.
Yeah.
Temperature type, other. Okay, so let's fix that. So in the vitals,
And then she gives me the wrong information. I almost sent somebody.
okay, so we need an other box at 25.
Let's see where he goes.
And then at 45.
I think that's where that oxygen question was on that one box that didn't have the box.
Yep, right here, frequency.
Right, should we have something
other.
that,
Yep.
like NA or not currently in use or something, because we only have continuous, what was it, PRN?
Oh,
I was thinking that it may not even, you know, apply.
pertain. Yep.
Yeah, so maybe instead of other, there should just be a button.
O2 set.
NA or-
Oxygen. But you could, oh, that's the wrong one. Okay, frequency of oxygen. But you could have an other. So I'm going to change this one to, no, let's move these. Let's do, move other. Put continuous here. Let's do NA first. Parent, stop. H, S. And then I'm going to add an other.
Right, okay.
Because it could be like just, I don't know. I had a nurse one time write oxygen 4 hours a day. Now, I'm not quite sure why her order was that. I never could figure that out, but just in case, let's add another here. Other O2.
It was just mixing, so now they have a box that they could go it in. I just didn't want to answer that last.
No,
I mean, I didn't really have a choice, so I just hit other, but.
You don't. Right.
I didn't really
Now let's look.
Didn't know what that meant.
Let's peek at it real quick. See if it looks okay. Okay, so other, and then here's other temperature type, pulse, other pulse type, respiratory, oxygen saturation, Oh, shoot, I put that in the wrong place. Okay, so the other O2 frequency, I need to move one line down.
Okay.
Should not be 75, that should be 85. And can you believe I don't even really like computers? And here I am.
In the same.
I have to kind of chuckle every once in a while at it, like, really? What am I doing? Okay. But I forgot to add other. Oh, I put other there. That's what I did. See why I don't like them? Because they never do what I want them to do. Okay, so. Sorry, let me fix this. I don't want other there. I actually want it. Here. Okay. All right. We fixed those. This is under character of pain. Other. And if you want me to, so you don't have to wait on here, I'll just go through this document,
Okay.
the other by other,
Right.
and add a box to the ones that don't have them.
Right, and then just if you can jot down the DEMA, I'm not sure if we just fixed that. There should be either none or NA, you know.
And which one? What
Under
was that on
edema,
it? Under
edema. I didn't really have anywhere to write none or NA or no edema.
Fetal pulse was something.
It wasn't a choice.
Pacemaker, cap refill, edema. Here we go. So this would be, okay, so we really want the NA to be the first choice.
Yeah, maybe at the, yeah, somewhere. And then can I ask you, under medications, under pharmacy, I noticed like Ventura County Pharmacy wasn't there, Concierge Pharmacy wasn't there. Are we supposed to give you those names of our pharmacies for the med profile?
That's actually something you guys put in under facilities. So I don't know who's doing that.
Okay, I'll find out, because when I did the
But
meds.
somebody on your side puts that information in.
Okay. Thank you, Christy.
You're welcome. Anything else?
I think I got that far last night and then went home.
Well okay, so enough. That's
it was
enough
about
for now.
9 o'clock our time, so I was like, I need to go home now.
Yes, you do. All right.
Okay.
Thank you.
Yeah, so I emailed you yesterday our current DME. Can we put those in, or was that too many?
No, you can put that. We can put that in. I just haven't had the chance to, because we've had as you know, we've had continual meetings.
Okay.
And so I like I say, it's on my list.
Okay.
We really needed to, and I know this isn't an option, but we really needed another month to get this stuff done correctly. But
yeah,
and we don't have it.
Oh, I did send you another email too. You probably wondered what it was, and so I was just asked you, maybe we can talk over the phone and discuss that other email. I think there were some things in the standing order, like the suprapubic catheter change was in our standing orders. Things like that.
Right. So there's things. So what you were saying in that one was, and I haven't had a chance to respond, but I did read them, is that your standing orders duplicate some of the care needs.
Yeah, and then we were missing some of the standing orders we needed in there. So yeah, I can discuss that at a later time too. I can call you. So
I can even show you how to get to the standing orders so that you can look through them and see what needs to, and you can delete what you don't want or change what you want.
Oh, okay.
So you're not waiting on me. So if you go to settings,
hold on. I'm not a computer person either. Settings,
You guys actually put these in here. I didn't put them in. Lookup tables,
Okay,
clinical support tables, and then physician orders suggested text.
okay,
And then when you go to that physician order suggested text, here's all of them that are in here. So if there's any that you want to edit, you're just going to click on the edit pencil and you can edit it.
okay,
If there's any you want to delete, you can trash can it if it hasn't already been used on a test patient. If it has been, sorry?
I'm sorry,
If it-
there's another meeting coming in. Okay,
If it's already been used, you can't, it won't let you trash can, but you can put an end date on it and just put the end date before you start taking patient, before you start documenting in here.
okay. Give it a go. Thank you.
Okay?
All right, thank you.
Thank you. Bye-bye.
Bye. So, Kristen had recommended to us, so we